Hi, my name is Karen Prophet. I'm from Centauri College of Health and Sciences. What I'm going to do today is to do my head-to-toe assessment on my client. The purpose of this video is to submit a graded assignment to my instructor. Hi, my name is Karen. I'm going to be your nurse for today. How are you?
Good.
Nice to meet you. So I'm here to do your head and toe assessment. I'm gonna ask you some couple of questions, if that's okay with you.
Yes.
All right. Can you tell me your name and date of birth for me, please?
Joseph Prophet, July 18th, 1978.
And how old are you?
40.
All right. Do you have any drug allergies?
No.
All right. So I'm gonna go ahead. Before I start my head to toe assessment, can you tell me where you at right now?
Centauri Hospital
And do you know why you're here?
for a checkup.
Okay. And what's today's date?
May 4th, 2019.
Okay. So let me go ahead and wash my hands, put on my gloves. All right, for my general survey, I can see that patient is alert and oriented ×4. He is able to shake my hands, verbally responsive. He appears as his stated age. He is mobile in bed, he able to sit up. He appears clean, his hygiene is clean, he appears appropriately. His mood is pleasant, his affect is calm, he is smiling and cooperative. So I'm gonna go ahead and do the head to toe assessment. All right, first, Mr. Joey or Joseph, I'm gonna start looking at your hair. I can see all your hair are all distributed from your scalp, your eyebrows, your eyelids, and you have your beard and your mustache. So now I'm gonna go ahead and look at your eyes. Can you go ahead and look at my nose, then check out your pupils. All right, and let me see your eyelids here. So do you have any problem looking, like problem of vision, blurry, tearing, or anything like that?
No.
All right, so his eyes are perla. He has 2 symmetrical eyes, no drainage or skin breakdown or redness that I can see. I'm gonna go ahead and look at your nose now. Can you tilt your head back for me real quick? All right, I don't see any open areas, skin redness, or lesions or anything. Do you have any problem breathing or congestion? No. All right, I'm gonna go ahead and look at your lips and your mouth. So her lips are moist and pink. I just want you to open your mouth for me. All right, his gums are pink. Do you have dentures?
Yes.
Okay, so is it like partial, full?
Top. Sleep.
Okay, so his lips are moist, his mouth is, mucous membranes are moist, gums are pink. I didn't see any irritation or soreness or anything. Now I'm gonna look ahead. I'm gonna go ahead and do the behind the ears here, see if there's any skin breakdown. I don't see anything. Any problem hearing?
No.
No? Okay. So, gonna go ahead and look at your lymph nodes right here. I'm gonna check behind your neck here and see if there's any tenderness here. All right. I didn't feel anything. And now I'm gonna check your carotid pulse, one on each side right here on your neck. And over here, so carotid pulse are palpable 2+ bilaterally. Now below your clavicle, I'm gonna check and see if you have any dehydration. A little pinch right here, no dehydration noted, no tenting. So Mr. Prophet, I'm gonna go ahead. Can you sit up for me? I'm gonna go ahead and check your lungs for your lung sounds and your heart sounds. So I'm gonna listen to your heart valve sounds first. So first, I'm gonna check your aortic valve here on your second intercostal space on your right sternal border. And that's your aortic valve. And then your left sternal border, your second intercostal space is your pulmonic valve here. And then your third intercostal space is your Earth's point. And then your fourth intercostal space is your tricuspid valve. And your fifth intercostal space right here on your midclavicular line is your mitral valve, which I have to count for 60. 1 minute for your heart rate. All right, so your heart rate is 80 beats per minute. Now I'm gonna listen to your lung sounds. So okay, I'm gonna put my hand over here and just deep breath. Okay, his chest is rise and fall symmetrically. I'm gonna listen to your lung sounds now. So your bronchovesicular here. Your vesicular. Your lower vesicular. Lower vesicular. All right. Now I'm gonna look at your back side. Yeah, turn your back for me. All right. So this is your bronchovesicular. Your bronchovesicular. Your vesicular. Vesicular. And your vesicular. Okay, and then lateral side, one on each side. Okay. All right, and then just a little breath here. Okay. Then your lungs sounds clear. Your chest rise and fall symmetrically. Okay, you can go ahead and lay back down for me. All right, let me go ahead and check your pulses. I'm gonna go ahead and start with your brachial pulse here. All right, so your brachial pulse graded 2+ bilaterally. And then your radial pulse. Your radial pulse are graded 2+ bilaterally. And I'm going to check your capillary refill. So, and it's less than 3 seconds there. And on the other side. All right, I want you to squeeze my fingers. All right, and then pull, and then push my hands. Okay, so your upper extremities are equal and symmetrical, equal in strength and symmetrical. So now I want you to lay down flat for me. Just want to see your abdomen here. So the contour of your abdomen is rounded. I see some hairs scattered or distributed on your abdomen. And no open area, skin irritation or anything. I'm gonna listen to your bowel sounds now, okay? Alright, all his bowel sounds are present and normal. Do you have, when was your last bowel movement?
This morning.
This morning. Do you have any problem, nausea and vomiting? Any
No.
difficulty urinating?
No.
Okay. So now I'm gonna go ahead and check out your lower extremities here. Alright, so now I'm gonna go ahead and check and see if there's any edema. Your pretibial edema here, there's no pretibial edema. And then your pedal edema, no pedal edema here. So everything's good. I'm gonna go ahead and check your pulses down here. Your posterior dorsalis pedis here. One in each side. Side, so it's graded 2+ bilaterally. And then I'm gonna go ahead and check your capillary refill here on your toenails, and it's less than 3 seconds. And your heels looks fine. I don't see any open area, skin breakdown or anything. And then I want you to, I'm gonna test your strength here. Just push for me, and then I'm gonna put my hands over here and pull towards you. So your bilateral strength is symmetrical, no weakness or anything. Are you having any problem transferring or ambulating or anything like that?
No.
No? Okay. So everything looks fine. Do you have any questions for me? Are you in a comfortable position right now?
Yeah.
All right, so I will see you again later. So in summary, my patient, his mobility is within normal limits. He's able to transfer without difficulty. His head, ears, eyes, throat, mouth are within normal limits. He does have some upper dentures, full dentures that he said that he has. His lungs are within normal limits, clear to auscultation, no adventitious sounds, crackles, or any abnormalities. His abdomen is soft and non-tender. Bowel sounds are present in all quadrants. All his pulses are graded 2+ bilaterally. His strength are equal and symmetrical. Right now he's in comfortable position, and I think this is the end of my video. Thank you.